Buy gift cards, even if you aren't buying anything else because you're stuck at home. Shop local businesses online. By buying from someone in our area, you're helping to keep people in their job. When you do go shopping, don't use cash. Paper money and coins pass through so many hands and carry all kinds of germs. Stay local, stay involved, stay in touch, and stay healthy.
Good morning. I'm Pam Cook with 1480 WHBC News. Governor Mike DeWine says the stay-at-home order will continue now through May 1st. The director of the Ohio Department of Health, Dr. Amy Acton, is on our WHBC News line. Good morning, Dr. Acton.
Good morning, Pam. Thank you so much for having me.
Oh, I'm so glad you could join us. It's got to be pretty grueling and emotional for you.
There's something about the purpose of all this. I have more hope than ever in humanity. I think this is waking us up.
We consider you as one of the heroes who emerged from this. Keep up the good work and stay safe.
Pam, thank you so much. Be well, everyone.
Get the podcast at WHBC.com.
The following program is sponsored by the Medicine Center Pharmacies.
This is the first show outside the studio as we practice social distancing to keep everyone safe. Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. Our special guest today is Jordan Hughes from Ohio Northern University. PharmD candidate Jordan has been with us for several years on and off and is preparing to graduate from pharmacy school in May. Jordan, welcome to the show. Thanks for joining us. We're looking forward to talking to you today.
Yeah, thanks for having me.
Today we have a lot to share with you. We want to take some time with Jordan to learn about his experiences as a pharmacy student. In addition, Jordan recently completed a rotation at Johns Hopkins Medical Center and wants to share with you important tips for picking up your prescription during a pandemic. As pharmacists, your health is our top priority, and during these unprecedented times, we hope to share vital information to help keep you safe inside and outside of our pharmacies. We'd like to remind our listeners today that our program will at some point be available on our podcast, and you'll be able to download that on your mobile phone, and you can look for Health Matters with the Medicine Center Pharmacy and listen to any of our programs anytime. If you have any questions today, you can post them up on Facebook, and we'll address them as we can.
Okay, Jordan, welcome to the show again. Please tell us a little bit about yourself and your background.
Yeah, thanks again for having me. From right down the road here in Louisville, Ohio. Graduated from Louisville High School in 2014. And after high school, I went directly to Ohio Northern University's pharmacy program. And through school, I've worked at Medicine Center as a pharmacy intern for about 3 years now, a little under 3 years. And I'm supposed to graduate pharmacy school here in May. Hopefully, with everything that's going on with the coronavirus thing, we're still going to have our ceremony and everything, but that's to be determined. Planning on taking my clinical and my law exam this summer and becoming a licensed pharmacist, and happy to say that I matched at our residency position at Ohio Health Riverside Methodist Hospital in Columbus, Ohio.
So, Jordan, we know you'll be graduating as a doctor of pharmacy. Tell our listeners what that means and how it's different from a registered pharmacist, a la RPH, or a registered pharmacist that most of us are familiar with.
Yeah, sure. So back in the early 2000s, the Doctor of Pharmacy degree, or the PharmD, as it's called, became the new degree that was required for newly graduating pharmacists to become registered pharmacists in the United States. So this degree can take anywhere between 6 to 8 years. I think there are some schools that take 5 if they go year-round. But Ohio Northern is one of only 7 pharmacy programs in the United States that offers a 6-year direct entry program. So what that means is you don't have to take the PCAT, which is pretty similar to the MCAT for medical students. You don't have to reapply after a couple years of undergraduate school. So once you're in from high school, you have to maintain a minimum GPA, and you're in the pharmacy program thereafter. So the first 2 years of the curriculum at Ohio Northern are pretty similar to what you would see for a typical pre-med or biology major. It's a lot of general chemistry, organic chemistry, physics, calculus, those types of things. Then the next 3 years are spent diving deeper into pharmacokinetics, pharmacodynamics, medicinal chemistry, and a lot of clinical application of the medications that we use. And the last 2 years are what they call modules, and they're basically single classes they're taught at an accelerated rate, focused on certain disease states. So some of these modules that we took were oncology, cardiology, infectious disease, and several other different modules that we had. So in each of the modules, we basically learned about all the drugs that were pertinent to the disease states, different interactions, chemical stability, mechanisms by which the drugs work. But there's a lot of different things that we do outside of the traditional classroom learning that's required of a pharmacist. So we're taught how to do vaccinations. We do a lot of point-of-care testing services. So a lot of the things that we do here at Medicine Center, we're taught at school. So blood pressure, blood glucose, lipid screenings, a lot of cool different things that they teach us there in the lab. We also do sterile and non-sterile compounding, basic life support and CPR, advanced cardiac life support, and we even become medication therapy management certified in our last year. After all the school on campus is done, we move into the final year of pharmacy school, and we complete clinical rotations where we travel around to practice sites and stay there for about a month and learn from the preceptors in their active practice sites.
Okay. You had to have had some really interesting rotations. How about giving us a little thumbnail sketch of a couple of them?
Yeah, sure. So this past year, I had the pretty unique opportunity to go and complete about half of my clinical rotations at the Johns Hopkins Hospital in Baltimore, Maryland. So I spent 4 months this summer in Baltimore and completed an internal medicine rotation, cardiology, leadership and management, which was like more administrative, and a surgical critical care rotation. So in these rotations, you are basically in an active practice site where you learn from your preceptor and you learn from real-life situations, and you use your knowledge from school to apply clinical uses of medications. You participate in multidisciplinary rounding. And I was actually even lucky enough to be able to work on a project to evaluate and improve the IV potassium repletion protocol on their cardiology step-down unit there. And then following those rotations in Baltimore, I came back to Ohio and was able to learn from a lot of great preceptors locally at Mercy Medical Center, Grant Medical Center in Columbus, and now I'm finishing up my final rotation here at Medicine Center Pharmacy. And I think one of the biggest takeaways from my rotations was just realizing how versatile pharmacists can be and how many different opportunities there are for us to have to really make an impact on patient health in a variety of different settings.
Okay. So I'd like to congratulate you now that you are moving on to Riverside Methodist Hospital in Columbus for a residency. Tell us about a residency and why is it important to your career?
Sure. So residencies become kind of a more popular route for new graduating pharmacists. It's a postgraduate training program that basically allows you to practice as a licensed pharmacist, but you're under the supervision of different preceptors and people that are pretty experienced in the area that you're practicing in at that time. So it basically allows us to take the knowledge from school and really polish that knowledge and move into real life situations, utilize your clinical knowledge on real patients and practice in actual live settings. So it's pretty similar to the residencies that physicians are required to complete. But a couple differences are it's not required, so not all pharmacists have to go through pharmacy residency. And it's a little bit shorter, so it can be anywhere from 1 to 2 years. And there's a bunch of different types of pharmacy residency programs. Some can be specialized in clinical areas. The one that I'm actually doing is pharmacy leadership and management, which is more of the administrative route. And then some programs are actually even specialized in community pharmacy, which I know we have a pharmacist that works at Medicine Center, Donnie Allison, who completed a community pharmacy residency down at West Virginia University. So there's a lot of different routes that you can take in the residency program. And then the specific residency that I'm completing at Ohio Health Riverside Methodist is a 2-year commitment. And it's called Health System Pharmacy Administration and Leadership. And my program is actually paired with a Master's of Health System Pharmacy Administration degree from Ohio State. So the first year is really focused on developing clinical knowledge of pharmacy. The second year is really focused on finance, supply chain management, leadership, medication safety, and so on. And then during these 2 years, I will be completing a lot of patient care activities, patient care responsibilities at the beginning of the day. And then at the end of the day, I'll move on and take night classes that are really focused on like quality improvement, human resource management, and how to responsibly manage financial resources.
Well, learning about a number of those subjects, including supply chain management and HR during a pandemic, should be fascinating, given all the things that we are continuing to be challenged with in this environment. So, Jordan, speaking of the pandemic, let's talk about how our listeners can be safe when it's time to pick up their prescriptions at our pharmacies.
Yes, so I think that's a good question. Right now, we are really stressing that people use some of the services that we offer, so whether that be utilizing free delivery services. So basically, our drivers will drop off the medication to you, so you don't really even have to leave the house. It's contactless delivery, so that's a good option for people who want to, practice social distancing and those things. Another thing, too, is if you don't feel well, don't come to the pharmacy. Send someone else to pick up your medications. Probably a good idea to keep your distance from others around you during these crazy times. And then, you can utilize our curbside delivery as well to pick up your medications and any other items that you might need from the pharmacy. So you can just basically pull up outside the pharmacy, send us a text, and tell us your name, what car you're in, anything else you might need from the store. One of our pharmacy employees will take care of you, check you out, grab all your prescriptions, grab anything else you might need. Don't even need to leave your car. So, and then I guess finally my last recommendation would just be general hygiene. Just wash your hands often, keeping your distance from others. Stay at home if you're sick, and try to avoid to touch your face, your eyes, mouth, and nose is my best recommendations. Try to keep everybody safe at this time.
You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacist Paul White and compounding pharmacist Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll continue with Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Jordan Hughes from Ohio Northern University.
All right, Jordan, now more than ever, it's important to be efficient with our trips outside of our home. How about you share with our listeners how it is an option for them to minimize their trips to the pharmacy by organizing their prescriptions? What can they do?
Yeah, I mean, I think it's important for people to make as little trips out of the house and to the pharmacy right now as possible. So one thing they can do is ask for all their prescriptions to be filled together, so that less deliveries or trips to the pharmacy are needed. We even have a program here where we can set the patients up for a friendly reminder call where one of our technicians will call them a couple of days before their refills are due, just to check in with them, see what they need refilled. That way it gives us some time to get all the medications together. That way the pharmacist can get everything checked, get it all together, and then the patient can just have one quick delivery made or one trip to the pharmacy. That way you're not passing a bunch of things back and forth and making unnecessary trips back and forth to the pharmacy.
Jordan, speaking of trips to the pharmacy, we're open right now through our drive-through window, and we also have home delivery available. How about you give our listeners an explanation of what our curbside pickup looks like and how they can use it when they pull up to any of one of our pharmacies?
Yeah, sure. So our curbside delivery service is a new process that we recently developed, working on. So patients can come in or come outside the pharmacy, pick up their medications without having to leave their car or come into the store. Basically, when you pull up, you can just shoot us a text or call to the store to let us know your name, what car you're in, what else you might need other than your prescriptions like thermometers, masks, gloves, hand sanitizer, anything like that. And our pharmacy team will get everything together, bring it out to your car, check you out from your car. That way you don't need to come into the pharmacy and touch anything like that. So this process really decreases the amount of contact that people will have when they come to the pharmacy and just really make sure that the social distancing guidelines are being followed to the best of our abilities.
Tell our listeners about the special offer we have going on for customers who make a purchase through our drive-through or curb service.
Yeah, sure. So right now, we're offering a little incentive for anyone who uses our drive-through or our curbside delivery service. So if a patient comes and has a prescription purchase or makes a purchase of $10 or more of OTC products like thermometers, Tylenol or Advil, N95 masks, we're going to be offering a free bottle of hand sanitizer to anybody who utilizes those services right now.
Okay, and this is an 8.75-ounce hand sanitizer, premium value. We have not sold any of this. We have donated almost every piece of this hand sanitizer that our company has been able to obtain to the police departments, cities that we service in, have our pharmacies in, many nursing homes. The nursing homes, as you know, have a great demand for hand sanitizer and other products like masks and that sort of thing. So help them out if you got some of this stuff. But try our drive-through window, try our curb service. We have a good staff there ready to take care of you. So that's the deal with the hand sanitizer. We're not selling it. We're giving it away.
All right, Jordan, how about you tell our listeners what to do, what they can do to protect and make sure that what we do at the pharmacy, to make sure we protect each pharmacist and delivery driver and technician to keep them safe inside our company right now.
Yeah, sure. So we've been following with the governor's recommendations, listening in to see if there's any updates every day. And with that, we created a policy that each and every one of our employees is screened upon the start of their shift. So when they come into the pharmacy or to the office, they get their temperature taken. They're asked a series of questions about signs and symptoms of the COVID-19 and asked about any kind of possible exposure from people around them or family members that could have been exposed as well. And if the staff member is found to have any of these signs or symptoms or found to have any kind of exposure, they're sent home immediately. We also have a couple other policies where we're disinfecting the pharmacy before, during, and after the workday. So we're really doing our best job down here to follow all the governor's recommendations to make sure that everyone's really being safe. We're protecting our customers, our employees, and our employees' families.
So, one of the things that's been made apparent, I don't think I ever really thought about, how about what should listeners do once they get home and they've been to the grocery store or they've been to the pharmacy with the items they brought into their home. Do you have any tips for them?
Yeah, so this is a good question, and I think a lot of people have been, wiping down their groceries or things that they get from outside places from their homes. And it's in response to a study that was recently posted on the New England Journal of Medicine, saying that the coronavirus can live on plastic or steel up to 72 hours and can live on cardboard for up to 24 hours. So if you want to take an extra step to protect yourself and your family, you could dispose of the prescription bag after going to the pharmacy before you get into the house. You can wipe down the bottles with disinfecting wipes. Then make sure to wash your hands after you're done handling all these things. I think that these extra couple steps are a way that people can really feel safe and protect themselves and their family in these times.
And how about getting these packages out of the house? When don't throw it in your trash under the sink. Put a separate trash bag in the garage or something like that. Same with the cardboard. Get the exposed cardboard boxes. Get the stuff out of them, and put this cardboard in the garage or throw it in the garbage can or something along that line. Don't keep it around you. Same with the plastic bags that you brought your food home in. Put them in a separate area where they can be recycled. So you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host, the Pharmacist, Paul White. Today, Brad and I are discussing pharmacy safety tips during this pandemic. We've got a lot more to cover this morning. We will get back to the show shortly.
You are listening to Health Matters with the Medicine Center Pharmacy and your hosts, Pharmacist Paul White and compounding pharmacist Brad White. Remember, the pharmacy is open regular hours, and to keep our patients and staff safe, please use our drive-through windows curbside pickup, or we can schedule home delivery for you. For more information, visit our website, medshoprx.com. That's medshop.rx.com. We'll continue with Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Are you tired of spending time sorting your medication? Hi, Pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to Health Matters with the Medicine Center Pharmacy. We've got a lot more to cover this morning, so let's get back to the show. Before we get back to the show, I'd like to give a shout-out to Lindsay's Restaurant on the corner of Dover and West Husk in Canton, Ohio. These people are really working hard to serve you. Obviously, the restaurant is not open. You can call for takeout, jump in the front door there, pick it up, pay for it. They have great food, breakfast, lunch, and dinner. It is closed, as I said, like all restaurants, and they are working like a great crew to put together excellent service, food, and takeout service. So give them a call, place an order, 330-455-6908. Don't forget about their pie. It's great. And their coffee. Lindsay's Restaurant, 1900 West Tuscarora Street in Canton. Phone number 330-455-6908. Call them and place an order. They're great people. So, Jordan, what should the listeners have in their medicine cabinet? Now, prepared. Be prepared. Okay, we're not sick, but we want to be ready, okay?
Yeah, I think that this is a good question, and I think to be prepared, you need to think about two of the most common signs and symptoms of the COVID-19 disease. And I think fever and cough are two of the most common symptoms. So for me, it would make sense to have every family make sure that they have a working thermometer at home, have cough suppressants, over-the-counter medication, cough suppressants. You can ask your pharmacist about, and they can help make any kind of recommendations for you. And fever-reducing medications like Tylenol and Advil are also an important thing to pick up when you're at the pharmacy. Now, it also would make sense to me to get things that everybody's trying to get their hands on right now, like masks, gloves, disinfecting wipes and sprays, also hand sanitizer as well.
All right, well, how about, in addition, we talk about how we can strengthen our immune systems in addition to what you want in your medicine cabinet. So, Jordan, how about a couple tips for what people can do just for overall health and well-being?
Sure, and I think this is something that, Brad and I have talked about quite a bit lately, and there's a couple different supplements that we recommend, the first of which being vitamin D3. This is one vitamin that is meant to really boost the immune system and reduce inflammation. Another one that's getting a lot of buzz around it is quercetin, especially in combination with zinc. Quercetin is thought to help the zinc penetrate the cells in the lungs and really help to reduce the inflammation that's caused by this disease. And then finally, vitamin C, always a good option for people who are attempting to boost their immune system. I know, Brad, you might have some others that you want to add in there, but those are the three that really come to mind for me.
Yeah, and, don't be afraid to consider, generally there's been really good studies on just a simple multivitamin, making that addition to your diet on a daily basis, can reduce things like the common cold by up to 20%. So a multivitamin would be a good benefit. A probiotic, a high-quality probiotic would be also good to help, restore and replace and support that gut flora. The majority of your immune system is in your gut. And if you think about, there certainly is a lot of concern about inhaling particles from this COVID-19 virus. But you got to keep in mind, everything you touch, if you touch your food and then put your food in your mouth, it's still going into your GI tract. So if you can keep your GI tract defenses up, that's something that certainly can give you some benefits also. But vitamin C is also an option. There's several things you can do, but good nutrition is one of them. So, when you're making your trips to the grocery, my wife continues to tell me that they're out of box things like macaroni and rice, but they always seem to have a nice supply of produce. So don't be afraid to get your fruits and vegetables. Add those to your diet, get those natural nutrients in there, but support your body with a multivitamin, vitamin D, probiotics, zinc and quercetin and things like that. And, don't be afraid to talk to us when you come up curbside. We can, you can call into the store or text us what you need, and we can help get you those things that can support your body the best at the pharmacy. So we're happy to help with that.
Make sure when you get your vegetables, fruits, and all that, you wash them thoroughly. The bagged lettuce and things like that should be thoroughly washed before you consume it.
So, Jordan, social distancing and hand washing are the most recommended habits to avoid COVID-19. What other good hygiene habits should listeners be practicing and keep both of them and their families safe?
Yeah, I think if they follow the general guidelines that have been put forth by the CDC The CDC has published the 5 rules, which I'm sure most people have seen by now. And those are social distancing, hand washing, like you said, and then also coughing into your elbow, staying at home if you're sick, if you're not feeling well, stay away from others. And like I said a little bit earlier, avoid touching your eyes, nose, and mouth. Those are probably the best guidelines at which people can follow to keep them and their family safe.
Don't be afraid to consider surfaces that you come in contact with to be contaminated. So, keep in mind door handles, gas pumps, things of that nature. You never know who touched them before you. So if you have the ability to either wear a glove or even use a paper towel to minimize your contact with that, don't be afraid to do that so that you can keep yourself safe.
So, Jordan, pharmacists are the most accessible healthcare professionals, as we know. Tell our listeners why having a relationship with a pharmacist is so important.
Yeah, sure. I think, just like having a long-term relationship with your doctor, your nurse practitioner, your physician assistant, I think it's very important to have that same level of mutual trust with your pharmacist. We go through years of training to be able to understand the science of how the body works. We have the education to manage complex therapies, but we can also help answer questions. If you give us the opportunity, we can even probably save you some money by reviewing your insurance plan to make sure it's the best fit for you. There's quite a bit of benefits to getting to know your pharmacist and using the same pharmacy, knowing that person every time you come into the pharmacy.
Okay. How about getting all your prescriptions at the same pharmacy? What's the advantage to this?
Yeah, I think the first advantage would be if you go to the pharmacy that you always use, they're going to have a complete medication history on record for you. And why that's important is because every time you fill a prescription at our pharmacy, we're checking for interactions. We're checking for interactions with other drugs, with food, some drugs that might have problems with certain disease states that you have. But if you fill at many different pharmacies, each of those pharmacies is just going to have a little snapshot of your medication record. So some of the medications that you're taking, might have serious interactions, drug interactions with others, but if we don't have that full record of what you're taking, we're not going to be able to know which drugs are interacting with one another. And I think a good example here would be to use is a drug that everyone's talking about right now, and that's the COVID-19 drug hydroxychloroquine. So let's say you get a new prescription for this medication and it comes to our pharmacy where we have your complete medication record. We would be able to look at that drug and see that it interacts with some pretty common medications that you might be taking, like Crestor, like Tramadol, metoprolol, and that's just a couple of the drugs that have kind of serious drug interactions with this COVID-19 drug. But let's say you take that medication to a new pharmacy where you've never filled before. They're not going to have that medication history, and they're not going to know what medications you take. That's just one way that some drug interactions or some serious issues can really come about if you use many different pharmacies.
So, what made you choose pharmacy as a profession?
Yeah, so I think this is probably something that I've answered quite a bit of times throughout pharmacy school and during residency interviews, and I think it goes all the way back to early in high school for me. I had a family member that was hospitalized for stroke-like symptoms. They went to the hospital. They couldn't speak. They couldn't walk, couldn't talk. Everybody did, the doctors did the test. They found no evidence of a stroke. So after days of being in the hospital, all the tests that were getting done, there were really no physical explanations or physiological explanations that were being able to be derived from the tests that we were getting back. So what we did was we looked at this family member's routine, and we noticed the only thing that had really changed was they had stopped drinking Diet Pop recently. They were drinking quite a bit of it, and then all of a sudden cold turkey stopped that. And we found out that it was basically like this person was withdrawing off a drug that they were addicted to, and it was from a artificial sweetener in the pop. So I think that that's one way that got me pretty interested in how different chemicals can affect the body, and things that are generally considered safe, like Diet Pop or herbal medications, over-the-counter medications, can't really have a harm on you, or can't have any harmful reactions in your body. But just noticing that is not always true. I think most people think that if something's natural, it can't really hurt you. But I can remember back in pharmacy school, I had a professor that said, bears are natural and they can hurt you. So I think that's kind of a good response when people think that anything that's natural is good for them. So, and I think it's a important fact when you think about if you're going to start any kind of new over-the-counter medications, any herbals. It's always good to talk to your pharmacist or your doctor before starting these things, because some of them can have serious health implications if it's taken in a combination with some prescription medications.
Okay. Completing your as you're completing your education, you're about done here in another month, right?
Yep.
Rotations in various pharmacy experiences. What's the biggest impression on you?
Yeah, and I think I'm going to give the Medicine Center a little bit of a shout out here.
Oh, a commercial, huh?
An unpaid commercial. That's right. I think being able to work at the Medicine Center Pharmacy was probably one of the best decisions that I made for my professional career. You know, I was able to meet and learn from so many great people, had the opportunity to learn from you guys and a lot of the store managers and pharmacists and technicians at the stores, and got a good exposure to different aspects of pharmacy, like, general customer service, a lot of clinical pearls that we use on a daily basis, a lot of the business side of pharmacy, and working with others to really create a successful team. So it took a lot of good experiences and a lot of good learning opportunities away from having this internship opportunity here. And I think that's really what pushed me to where I am now, and kind of shaped where I'm heading in the future.
Is it time for a break, JD? I believe so. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, Pharmacist Paul White and compounding pharmacist Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. Health Matters with the Medicine Center Pharmacy will continue in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, Pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Okay. This is the last segment of our show. What's up?
All right, well, I wanted to make a public service announcement here. I've been getting emails and texts and questions from patients and providers about the low-dose naltrexone and the CBD oil seminar that we're going to give this next Thursday on April 7th at 6:30 p.m. And obviously, we can't do that live in person, so we're going to have it in some fashion online. It's either going to be Facebook Live or another digital medium. And by the end of the day, I'll be announcing and publishing to our website and Facebook pages how we're going to do that. So for those of you who have been interested, stay tuned, and we'll find a way to make that happen. And we'll do it online, and hopefully it'll give everyone a nice ability to participate with questions in an interactive manner. So I appreciate your questions and your feedback on that, and more details to come very soon. So, Jordan, I know your parents are listening proudly. So how about you give a little shout-out to your parents and any other family, friends, or schools that you want to thank for your opportunity to be here today?
Yeah, sure. So I think I first want to give a shout-out to my parents listening in from Louisville, Ohio, Terry and Pam Hughes. And I think I want to give a shout out to somebody listening in all the way from Baltimore, Maryland, my girlfriend, Mary Fred Evans, and maybe even her mother up in New Jersey.
What's she doing in Baltimore?
She lives in Baltimore. She lives there. Even her mom probably up in New Jersey is listening. So Miss Pepper Evans, shout out to you guys too. So just wanted to say thanks to everybody who, has helped me along the way of this process, and really wouldn't be here without all the people who have helped me and supported me. So thank you.
Well, we certainly at the pharmacy level continue to evolve, much like many industries are right now in these unpredictable times. And I keep hearing the new normal, and it makes me think about how healthcare is going to continue to change. One of the things that we are trying to do at the pharmacy level is still be accessible to our patients who have questions. Really, the pharmacy ends up being an environment where we end up kind of triaging a lot with people who have questions who can't necessarily get to their providers. And I would say that a time like right now is even more pressing with when people have fears and questions and they need to get those answered, but they can't get to their provider. Maybe they're not open, or maybe it's only telemedicine that's available. So, one of the things we're going to do throughout this next month is we're going to have the students that have joined us from Ohio Northern University help support our patients in a manner with some outreach programs that we're going to work on to try to help make sure everybody's connected and can still be confident in their health care. So, if you get a phone call from one of our students, we hope that you can engage them and help get your questions answered. Don't be afraid to call into the pharmacy, and we can help you with those. Or use our website, medshoprx.com. That's medshoprx.com. Can be a resource for you to get into contact with any one of our pharmacies, and we can help make sure that you get the questions you have answered. Jordan, what's the next chapter for your pharmacy career, and what do you hope to use that can help you connect with patients and make meaningful impact in their lives?
Yeah, so I think the next step for me is going through and doing this 2-year residency and getting my master's and continue to learn from people who are pretty established in the field. And I've learned so many great things from being an intern here, having the opportunity to learn from a lot of the patients that come through every day. And I hope that throughout pharmacy, I can, my career in pharmacy, I can continue to have an impact on patient health every day. That's one thing for me, and that's kind of the reason why I'm pursuing this residency and moving into this field. Is I think I can use my skills to have a good impact on patient health on a health system level, and hopefully can continue to impact people in a positive way. So.
We've had over the years a lot of pharmacy students. Right now we have 5 from Ohio Northern. And as Jordan mentioned, they're doing a lot of things to support our company. They're doing medication therapy management tips. They may call you if you're a patient of ours. And please drain all their knowledge you can possibly drain. These students are far better trained coming out of pharmacy schools now than 15, 20 years ago. So The rotations give them experiences that in their lifetime they probably would never have run into. So help them out. They're going to help you out, and we're going to continue to have students come to us during the school year if it ever gets started again. We don't know what the current situation is with the schools, high school, grade school, or college or university. So we hope to get back on square one here pretty quick and get things sort of back to normal. But meantime, we're here, and we're here to help you. You can call us any of our stores, and we'll support you and try and do our best to keep your life comfortable in this time when you're kind of locked in your house. So, but anyway, that's kind of the deal. What else do you have, Brad?
Well, I just got a question here from an inquiry on Facebook about our curbside service. So once again, we have all our pharmacies are open. Okay, you're able to access your prescriptions. You're able to get our access to what we call over-the-counter, which is everything in front of the pharmacy. So think of Tylenol and toilet paper and canes and walkers and things like that. So if anything that's in the pharmacy, you have accessible to you either a couple of ways. You're welcome to pull up to our drive-through windows. We have a drive-through window at each pharmacy, so it's real easy to buzz through there and get your stuff. We have home delivery available that we can schedule. You can appreciate that more people are looking for home delivery in this environment, so we're happy to schedule you to meet the need the best we can for you. And the other thing is curbside. So, if you've ever pulled up at a restaurant like Carrabba's up at the Strip, you pull up at the curb, we've got orange signs out in front of every pharmacy with a text phone number. If you don't have a phone you can text on, it's no problem. You just call the voice line for the pharmacy. But what you do is you pull up, you text that phone number, and then what you can do is just put your name and your car and that you're here for pickup, and then our staff will text you back and arrange what else you need, and we can bring it right out to you, and you don't have to get out of your car. So it's really easy and convenient. So take advantage of that, and we'd be happy to make sure that you have everything you need. And if you have questions, then the pharmacist can call you on the phone, and they can go over any drug interactions you're concerned about, or they can work on anything that you have questions about, that, like we mentioned earlier. You're looking to boost your immune system, no problem. We can give you a recommendation on the amount of vitamin D or a multivitamin to take, and try to keep you healthy and happy in that way. So, Jordan, any parting comments before we head on down the road here?
Yeah, I think I want to comment on the situation with the stay-at-home orders.
Quickly.
And I think Governor DeWine, who is a fellow polar bear, for those of you who didn't know, ONU grad. I think he showed good leadership, and I think the people of Ohio have had a pretty good response to that, and they're doing a great job handling tough situations. Mm-hmm. Just trying to keep in mind that this storm 2 is going to pass, and it's only temporary. So,
thanks to Jordan Hughes, Medicine Center Pharmacy. Remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelos. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday, right on News Talk 1480 WHB. And support your local businesses like Lindsay's Restaurant.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
The director of the Ohio Department of Health, Dr. Amy Acton, and is on our WHBC Newsline. Good morning, Dr. Acton.
Good morning, Pam. Thank you so much for having me.
Oh, I'm so glad you could join us. It's got to be pretty grueling and emotional for you.
There's something about the purpose of all this. I have more hope than ever in humanity. I think this is waking us up.
We consider you as one of the heroes who emerged from this. Keep up the good work and stay safe.
Pam, thank you so much. Be well, everyone.
Get the podcast at WHBC.com.